People that advocate for the opening of schools will cite a couple of different reasons. First, they believe that COVID-19 shouldn't have control of our community. They think that we should establish a certain level of normalcy, and opening schools will provide that. There's also an economic factor. When schools open up, a lot of people get their jobs back, not just within the schools, but in the surrounding businesses that provide support for those schools. Also, people that don't have childcare are able to go back to work because the school provides that childcare, and those are very valid points. But what are you willing to sacrifice to get those benefits? Now, on the other side of the spectrum, there's a variety of reasons why it is a bad idea to open schools. And I'm not going to discuss all of them, but I will advocate for the remaining of the schools being closed through two main and really important reasons. First, there's the fact that kids do get sick, which is contrary to the common misconception that they don't. And then there's the liability factor. What happens when all the safety measures that we have in place don't work out? So let's talk about that common misconception. Kids don't get sick. Well, according to the CDC, the Center of Disease Control, there's 3,500 confirmed cases of kids getting sick. Now, in the grand scheme of things, considering the overall number of active COVID cases, that's not a very big number, but that's still 3,500 kids that are sick. Now, how do we get to that number? I would argue that at least to a certain extent, the fact that schools have been closed since March has played a very big role into limiting the amount of cases of children getting sick. The kids only socialize really in school, in daycares, and in places like that have been remained closed throughout the pandemic. So that does lend to reason that the fact that schools have been closed has minimized the amount of cases amongst children. Now, the fact that kids aren't necessarily tested for it, or the fact that COVID-19 doesn't affect them in a severe manner, doesn't mean that they don't get sick. In fact, most kids, even when they do contract the disease, remain asymptomatic. The problem with that is that asymptomatic cases are actually more likely to transfer the disease to other people. Now, also, a recent study that was published in the New England Journal of Medicine suggests that there was about 300 cases of children that had contracted COVID-19 that later on contracted an inflammatory disease. Now, the kids that got that inflammatory disease, 80 to 90% of them had to receive intensive care at their local hospitals. And 2% of those cases actually passed away. So to say that kids don't get sick is just simply not true. Now, we also have to consider the adults around these children. The people that are teaching these children, the people that are feeding them food and going and cleaning after them are all adults. And the average age of a teacher is about their mid-30s. But we definitely have teachers that are in their 40s, 50s, and 60s, which is amongst the most vulnerable population. Some of them even have underlying diseases that make it even more vulnerable to COVID-19. And now you're asking them to take on that risk and potentially sacrifice their lives in order to gain normalcy or to provide a little bit of economic relief. Would you be willing to make that sacrifice? Now, if we move on, of course, there's going to be safety measures in place. But schools are a microcosm of the environment that they are in, of the communities that they are in. So all those problems that we had within our communities are likely to transfer to schools. Now, one example is the fact that within our communities, there's very many people that because of their political beliefs don't think that we need to be wearing masks. Now, those people have children, and those children are going to go in our schools. Are they going to wear a mask? Are we going to make it mandatory for them to wear a mask? And if those kids don't wear a mask, are the parents of the kids that want to wear a mask going to be willing to send their kids to school? Now, that's just one example because we've had many restrictions in place that have not been followed within our community. We asked everybody to stay in their homes. Nobody did. We asked bars to close, yet they're still open. We asked people not to socialize and have parties, and we have seen countless cases of parties that end up being the center of the spread of the disease. So now we can't control our community. How are we going to be able to control our schools? All we're going to